Struggling with depression, anxiety, or trauma is hard, but flexible, powerful care exists. Outpatient treatment. What if you could achieve 3 years of therapy progress in just 1 month without turning your life upside down? This isn't a shortcut. It's the power of structured, intensive outpatient programs designed for rapid results. For patients who complete their programs, studies show success rates can be as high as 78%. We'll now break down the science, the methods, and the real-world advantages that make this healing possible. First, outpatient care fits into your life. You can continue work, school, and family duties while in treatment. It's also more affordable. Outpatient treatment generally costs much less than inpatient programs. Technology makes it even more accessible. Telehealth and apps break down geographical barriers for many people. Some think outpatient is just a step down from the hospital. For many, it's the right primary treatment from day one. So it's flexible and accessible, but what actually happens inside treatment that makes it work so well? The success of any therapy depends on one element above all, the therapeutic alliance. This is the bond between you and your therapist. Why is this connection so vital? It creates a safe space to challenge old patterns. It's the foundation for all other techniques. It has 3 parts: the emotional bond, the therapist's empathic understanding, and your shared agreement on treatment goals. On the flip side, a weak alliance is a top predictor of dropout. This proves the relationship is as significant as the methods. This alliance makes you an active collaborator in your own healing, not just a passive recipient of instructions. So, with this strong connection established, what is the gold standard tool that therapists use to create change? The answer for many is cognitive behavioral therapy, or CBT. It's one of the most researched methods for depression, anxiety, and PTSD. The numbers are impressive. For depression, studies show significant long-term remission rates and symptom reduction. For anxiety and PTSD, the data is just as strong. Scientists measure this with effect size, and CBT shows a large, meaningful impact. How does it work? By actively rewiring the brain's faulty thinking patterns. It helps you unlearn traumatic responses. Patients going through this process report real changes: fewer symptoms, better sleep, and a more positive view of their future. So we have a strong alliance and proven tools, but some of the most powerful parts of outpatient care are the ones you'd least expect. Here's a surprise. For trauma, rotating therapists can actually speed up healing. Different perspectives can spark breakthroughs. Another powerful component is group therapy. Connecting with peers provides shared insights and diverse coping strategies. But the biggest advantage is applying what you learn immediately. You practice new skills in your real life every single day. We must be realistic. This work is difficult. Directly confronting trauma is demanding, which can lead to higher dropout rates in some programs. So how do all these pieces, the flexibility, the science, the real-world practice, fit together to create such profound change? This is the core insight. Recall how outpatient care allows you to practice skills in your daily life, and how CBT works by rewiring thoughts. Outpatient treatment creates a powerful feedback loop. You learn a skill in therapy, test it at work or home, and bring the results back. This constant cycle of learning, applying, and refining dramatically speeds up the rewiring process. It makes recovery sustainable. This feedback loop is how intensive programs can condense years of progress into months. It's not magic. It's integrated, real-world healing. So, outpatient care works through a combination of factors: flexibility that fits your life, proven methods like CBT, and real-world application. It offers a path to significant, lasting recovery from depression, anxiety, and trauma that is both accessible and deeply impactful. Healing doesn't have to mean stopping your life. It can mean transforming your life right where you are. If you or someone you know is struggling, look into evidence-based outpatient options. It could be the first step toward a new future.